Hello and welcome to McLaren Port Huron's Today's Health Program. I'm your host, Michelle Baker. Today we'll be talking about a common cause of stomach pain, which is GERD. Joining me is board certified general surgeon, Dr. Zubin Bhesania. Doctor, thank you for speaking with us today.
Thanks for having me.
Now let's begin with an overview. What is GERD?
GERD stands for gastroesophageal reflux disease. So it's very common. People call it heartburn, indigestion, dyspepsia, are all sort of words for the same problem.
What are the symptoms other than the obvious feeling of burning?
So heartburn or the burning sensation is very common. People will actually reflux food or bile or acid in the back of their throat and have a sore throat from that. There's a risk of aspiration from reflux.
Now, because it's so common, what causes it?
Well, GERD is due to a dysfunction of the lower esophageal sphincter. And you can see on this animation, there is a valve between the esophagus and the stomach. And food normally travels through the esophagus and into the stomach. And this valve at the lower part of the esophagus creates high pressure, so the contents of the stomach does not come back up into the esophagus. So when there is a dysfunction there, you have reflux.
Are there certain factors or conditions which put you at risk for developing GERD?
Sure, there are some things you can do to minimize GERD. So if you have a lower esophageal sphincter that's not working properly, by avoiding eating before you go to bed, so you should try to avoid eating several hours before you go to bed. Don't drink any liquids before you go to bed, because when you lay flat, the stomach and esophagus can reflux very easily. Also, weight loss will help. So if you can lose weight, the pressure from the abdominal wall won't squish your stomach, and so you'll have less reflux as well.
So for those who have GERD and they choose not to get any treatment for it, are there any health risks associated with ignoring GERD?
Sure. So GERD actually is burning the inside of the esophagus. So when the acid comes up, it will damage the lining of the esophagus, because the esophagus is not designed to handle stomach acid. It doesn't have the same protective layers that the stomach has. So if you have gastric contacts coming up into the esophagus, it will burn the lining of the esophagus. And that's why people complain of this pain or this heartburn. Now, over time, that will cause scarring of the esophagus and lead to something called Barrett's esophagus, which then over time can break down and in very extreme cases create problems such as esophageal cancer.
So if you have frequent bouts of this acid reflux and you don't seek treatment for it, it can have some very serious potential health risks.
Sure. Long-term problems with GERD can create some very serious problems. It doesn't happen to everyone, but it gives you a higher risk for this.
Doctor, this is great information. We need to take a break. We'll continue in a moment.